pivot into something pretty huge. Sri Lanka's plan to build a national electronic health record system, that's EHR for all you acronym fans out there. We've got excerpts from their actual proposal here. So we're getting like a behind the scenes look at their goals, their challenges, and what all of this could mean for healthcare in Sri Lanka. Just imagine connecting every single citizen digitally for healthcare. That's the scale we're talking about here.
Yeah, it's a really ambitious undertaking, and the proposal does a good job of laying out the current situation. They're starting with what they call a fragmented system. They actually compare it to trying to fit a glove on a hand, where each finger is like a different size. Their current setup has a whole bunch of separate electronic medical record systems, EMRs.
Yeah.
And the problem is they just don't work together.
So not exactly plug and play, huh? I mean, you would think with all the tech advancements we have these days, getting systems to talk to each other wouldn't be such a big deal. What are they up against specifically?
Well, it's kind of like trying to merge a bunch of different languages.
Well,
In day one universal language,
so
there are compatibility issues to solve, potential workflow disruptions for doctors, and then there's the ever-present data security headache.
Mhm.
And of course, you can't forget about the elephant in the room, the financial resources to make it all happen.
yeah, that's a lot to handle. And from the sounds of it, they're also expecting some pushback from the doctors themselves.
Oh yeah, they definitely recognize the human element in all of this. The proposal mentions that a lot of doctors are already feeling overwhelmed, so adding a whole new system, even if it's meant to help, could be met with resistance. They're even considering things like bonuses to encourage participation.
Bonuses, huh? I wonder if that's sending the right message. Will it attract doctors who are actually interested in using the EHR to improve patient care? Or just those who are after a little extra cash? It'll be interesting to see how that plays out.
Yeah, it's a valid concern for sure, and something they'll have to handle carefully. Another big hurdle they're facing is reaching those rural communities where access to healthcare is already limited.
Right, the proposal really highlights that. Provider shortages, people having to travel long distances for even basic care. It's a pretty stark picture. So, what's their solution for bringing healthcare to these underserved areas?
Their big idea is a network of mobile healthcare vans, equipped with tech that allows doctors to provide support remotely. They're even talking about putting basic screening tools in ambulances and connecting them to specialists in urban centers. Imagine you're in a rural village and suddenly you have access to specialists in Colombo.
That's a pretty powerful image. But didn't the proposal also mention that internet access can be spotty in those rural areas? How are they going to guarantee reliable connectivity for these mobile vans and ambulances? It seems like a pretty massive logistical challenge.
You're right, that's a crucial point. It's one thing to have the technology, but the infrastructure has to be there to support it. And then on top of that, there's the issue of provider shortages. Even with these mobile vans, you still need qualified healthcare professionals to staff them. It makes you wonder if this solution is really sustainable long term.
It's definitely a lot to consider, and we're really just scratching the surface here. But one thing is clear, Sri Lanka is serious about tackling this head on. They see the EHR as a major weapon in the fight against a serious health crisis, non-communicable diseases, or as they're more commonly known, NCDs. And the statistics are really quite alarming.
Oh, they're definitely facing a crisis. The proposal says that a whopping 83% of deaths in Sri Lanka are due to NCDs, heart disease, cancer, diabetes, you name it. What I find interesting is how they're approaching this. They're not trying to reinvent the wheel. They're looking at how to integrate the EHR with systems and initiatives that are already in place.
So working smarter, not harder. Can you give us an example of what that looks like in practice?
Sure. They've already started rolling out e-health cards to create individual health records for citizens. And they're using a platform called DHIS2, which is already being used in a lot of preventative healthcare settings for data collection and analysis. It's kind of like a central hub for tracking key health indicators.
Okay, so that's building on what they already have. But what about brand new systems?
Well, they're proposing a cloud-based system called Slamia, which would act as a personal health record portal. It would let people manage their own health data and share it with their healthcare providers, whether they're in the public or private sector.
So it's putting the power in the hands of patients. But let's talk about medication adherence for a minute.
Yeah.
We know this is a big problem, especially with chronic conditions. People forget to take their medication. Life gets in the way, and ultimately their health suffers. How does the EHR address this?
This is where it gets really interesting. They're talking about using the EHR for things like automated reminders. Think of it like personalized messages that pop up on your phone. And e-prescriptions sent directly to pharmacies, so there are no more lost paper prescriptions. They're even considering patient portals, where people can access their medication info and instructions anytime, anywhere.
It sounds like they're trying to build a digital safety net to help people stay on top of their medication. But of course, all of this comes with a price tag. And we know that healthcare costs are a major burden for a lot of Sri Lankan households, especially those with lower incomes.
Oh, they're definitely aware of that. The proposal actually explicitly addresses the potential of the EHR to reduce out of pocket expenses. The idea is that by streamlining processes, expanding access to care, and reducing things like duplicate tests and potentially even fraud, the system could lead to some serious cost savings for patients.
Well, that's the hope anyway. But I have to admit, I'm a little skeptical. We've seen these EHR projects in other countries go way over budget, and those promised cost savings never quite materialize. What makes Sri Lanka think they can pull this off? Does the proposal offer any concrete evidence to back up these claims?
It's a good question. And to be honest, the proposal is a little vague when it comes to the financial side of things. They talk about the potential for cost savings, but they don't really break it down or offer any hard numbers.
So, a bit of a leap of faith then.
Maybe, but they do highlight a whole bunch of other potential benefits beyond just cost savings. They see the EHR as a gateway to a whole range of opportunities for improving healthcare in Sri Lanka.
Okay, I'm all ears. What kind of opportunities are we talking about here?
Well, first and foremost, they envision a system that provides centralized healthcare data for every citizen. Imagine a doctor in Colombo can instantly access the medical history of a patient in Jaffna, even if they never met before.
That could be a game changer for coordinated care. No more duplicate tests, no more guessing about a patient's past treatments. Could also be really valuable for public health initiatives. Having that kind of data at your fingertips to track disease patterns
Sure.
and target interventions.
Exactly. They're also banking on the EHR to improve healthcare delivery in rural areas. Remember those mobile healthcare vans we talked about earlier? They would be able to tap into this centralized data system, making it easier to connect patients with specialists and resources.
So it's not just about bringing healthcare to the people, it's about bringing the right healthcare to the right people at the right time.
Precisely. And of course, they're hoping the EHR will be a major factor in managing those NCDs more effectively, whether it's through better patient education, medication adherence support, or just having a more holistic view of each patient's health journey.
It sounds like they're really trying to build a system that works for everyone, regardless of their location or socioeconomic status.
And they're not stopping there. They see this EHR as part of a much larger digital transformation that's happening in Sri Lanka, one that touches on everything from education and finance to governance.
Okay, so how does this fit into the bigger picture? What else is happening on the tech front in Sri Lanka?
Well, they mentioned Sri Lanka's National Digital Economy Strategy 2030, which aims to make the country a digitally empowered nation. And healthcare is a key pillar of that vision. They see the EHR as a crucial step towards achieving that goal.
Okay, so we're back. And in this part of our deep dive, we're going to shift gears a little bit and focus on the human side of Sri Lanka's EHR project. Because yeah, the technology is really fascinating. But at the end of the day, this is about people, patients and healthcare providers on the front lines. So what does this ambitious plan actually mean for them?
Well, the proposal really acknowledges that these human factors are critical to the success of this whole thing. It dives into the potential benefits and challenges, not just from like a tech perspective, but for everyday Sri Lankans.
Okay, so let's start with the positives. How could this EHR system actually improve the lives of patients, especially those who've been struggling to access quality care?
One of the biggest areas of focus is improving access for people in rural communities. We talked about those mobile vans and telehealth earlier, but the EHR is kind of like the backbone that connects it all. The idea is to bridge the gap between rural patients and specialists in urban areas to try and create a more level playing field.
So it's almost like bringing a top-notch hospital to their doorstep, virtually at least. The proposal also talks a lot about empowering patients, giving them more control over their own health. How does the EHR play into that?
Well, they envision these patient portals where individuals can access their own medical records, track their progress, and even communicate directly with their healthcare providers. It's all about giving people the tools to be active participants in their own healthcare journey, not just passive recipients.
I think that's especially important in a country like Sri Lanka, where they're dealing with a rising tide of non-communicable diseases, or NCDs. Managing conditions like diabetes and heart disease requires a lot of self-management from the patient.
Oh, absolutely. And the EHR can be a really valuable tool in supporting that. Think about things like personalized reminders for patients, educational resources that are tailored to their specific conditions, even access to online support groups where they can connect with others who are facing similar challenges. It's all about providing a support system that extends beyond just the doctor's office.
So it's not just about digitizing records, it's about creating a more patient-centered approach to healthcare overall. But let's be real for a second. Any big change like this is going to come with some downsides. What about the challenges for healthcare providers? They're already stretched so thin. How are they supposed to adapt to this whole new system?
Well, the proposal does acknowledge that there is potential for resistance, especially among healthcare workers who are already feeling overworked and stressed. They emphasize the need for these comprehensive training programs to make sure everyone feels comfortable using the new technology.
Training is definitely key. But it's not just about teaching people how to click buttons, right? It's about addressing their concerns, making them feel like they're partners in this whole process, not just people who are being forced to use some new tech tool.
Right, it's about creating that sense of ownership and buy-in. The proposal talks about how important clear communication is right from the start, explaining the benefits of the EHR to healthcare providers, and addressing their concerns head on.
Transparency is huge, and it can't just be a one-time thing either. They need to provide ongoing support throughout the implementation process and be responsive to feedback from the people who are actually using the system.
And you can't forget about the patients either. I mean, if people don't understand how to use the system or they're worried about their data privacy, the whole thing kind of falls apart.
Absolutely. Imagine someone in a rural village who's never even used a computer before, and now they're suddenly expected to navigate this patient portal. It could be super overwhelming. What does the proposal say about addressing that digital divide?
Well, they outline this multi-pronged approach to patient education. It includes public awareness campaigns, community outreach programs, and even partnerships with local organizations that can provide digital literacy training. It's about meeting people where they are and making sure everyone feels comfortable with the new system.
And what about data privacy? I mean, that's a huge concern when we're talking about sensitive medical information being stored electronically. How are they planning to address that?
Well, they emphasize the need for strong security measures
Yeah.
and compliance with all the relevant data privacy regulations. They want to make sure that people feel confident that their information is being protected.
It sounds like they're trying to cover all the bases, but at the end of the day, the proof is going to be in the pudding, right? I mean, we've seen data breaches happen even in the most secure systems. It's a constant arms race.
Oh, absolutely.
Yeah.
And it's not just about protecting data from hackers either. It's about using it responsibly and ethically. Things like, what are the rules around sharing data with researchers or insurance companies? These are all things that they need to define clearly and transparently.
So beyond those kind of broad challenges, they're also looking at how to use technology to address some of Sri Lanka's specific healthcare needs. What stood out to you in that regard?
Their approach to medication adherence really caught my eye. It's a huge problem, especially for folks with chronic conditions. Imagine using the EHR to send personalized reminders to patients when it's time to take their meds, or even tracking their prescription refills to make sure they don't run out.
Yeah, it's like a digital safety net to prevent those gaps in care that can lead to serious complications. That could be a game changer for managing chronic conditions, especially for people who have trouble remembering those complex medication schedules.
Exactly. And they're also thinking outside the box when it comes to mental health care. They propose using AI-powered chatbots to provide confidential mental health assessments. It's a way to break down the stigma and reach people who might not be comfortable seeking help through traditional channels.
That's really fascinating. Imagine someone in a rural village who's dealing with anxiety or depression, but they feel ashamed to talk to a doctor about it. A chatbot could offer the safe and anonymous way to get some initial support and guidance.
Exactly. And then there's the potential of using wearable technology to monitor patients remotely, especially those with chronic conditions. Imagine a system that tracks things like your blood pressure, blood sugar levels, other vital signs, and it does this all in real time. And then it alerts your doctor if anything seems off.
Wow, it's almost like having a virtual doctor by your side 24/7. And I imagine that could be especially beneficial for people in those remote areas who have limited access to in-person care.
Right? They even talk about using wearable technology in ambulances to provide real-time monitoring and data transmission to hospitals, which could be life-saving in emergency situations.
It sounds like they're really trying to use technology to overcome those geographical barriers that have been such a problem for Sri Lanka's healthcare system for so long.
Yeah, it's definitely an ambitious plan, but it's also a good reminder that technology is just a tool. The true success of this project is going to depend on how well they navigate the human side of things, addressing the concerns of healthcare providers, building trust with patients, and ultimately making sure that everyone benefits from this digital transformation.
It's about finding that balance, right, between innovation and accessibility, between pushing the boundaries of what's possible with technology and making sure that it actually serves the needs of real people.
Absolutely, and it's a journey that's just beginning. There are going to be bumps in the road, unforeseen challenges, probably a few course corrections along the way.
But it's definitely a story worth following. And in the final part of our deep dive, we're going to zoom out even further and consider the global implications of Sri Lanka's ambitious plan. All right, so we've really dug deep into this Sri Lankan EHR plan, from the tech hurdles to the impact on patients and doctors. But now, let's step back for a minute and look at the bigger picture. What can Sri Lanka's experience teach us about this global push for digital healthcare?
You know, in a lot of ways, Sri Lanka's journey is kind of a microcosm of what's happening all around the world. You've got countries everywhere trying to figure out how to modernize their healthcare systems, and technology is seen as a key part of that. But there's no magic bullet, no one-size-fits-all solution. What works in a small island nation like Sri Lanka might not be the right fit for a huge country like India, or a place with a super